We are Team 6. Our PICO question is, in pregnant women with gestational diabetes, would a modified diet when compared to insulin administration lead to fewer complications during delivery and postpartum care?
Hello, my name is Hannah Lectu.
My name is Janai Palendi.
My name is Kyle Soto.
And my name is Bonnie Sui. We are Level 3 students at UNLV's School of Nursing. This is our PICO poster.
Hello, my name is Hannah, and I'll be presenting the background information. Gestational diabetes is defined as diabetes that is diagnosed for the first time during pregnancy. The incidence of undiagnosed gestational diabetes is rising and complicates up to 10 to 25% of all pregnancies worldwide. The incidence of gestational diabetes has been associated with the rise in sedentary lifestyles and unhealthy diets across the nation. With these rises come complications during the labor and delivery process. Some of these complications include macrosomia, polyhydramnios, increased neonatal morbidity, and hypoglycemia in the newborn, which can lead to developmental disabilities. A long-term neonatal and obstetric complication includes the development of type 2 diabetes. The two current treatments offered to those diagnosed includes insulin administration and diet modification.
Hi, my name's Kyle, and I will be describing the purpose. Our purpose is to evaluate if the effectiveness of a modified diet will lead to fewer delivery and postpartum complications when compared to the administration of insulin with gestational diabetes mellitus, also known as GDM. For a PICO question, for the population, we are looking at mothers with gestational diabetes. For our intervention, we are looking at diet modification. For comparison, we are comparing insulin administration. For our outcome, we are looking for less complications for delivery and postpartum care. And then for the type of question or type of study, we are looking at patient safety and therapeutic response. Hi, it's Kyle again, and I will be describing the evidence we used. We used multiple sources, which are listed on this slide. For sources, we looked at systemic reviews, meta-analyses, pilot studies, integrative reviews, randomized trials, observational studies, and cohort studies. For the grading of each of these evidence articles, we used the grading of recommendations, assessment, development, and evaluation, also known as GRADE. They are scored from A, B, C, D, and we only looked at evidence that used A or B ratings.
Hey guys, it's Janai. The following information is a summary of what we found using 6 grade A and 7 grade B articles. Regarding insulin use, it generally resulted in higher incidence of complications in neonates, larger occurrence of neonatal morbidity, and larger infants to be born. Infants born to mothers who used insulin for their gestational diabetes had a significantly lower birth weight, a lower gestational age, and a higher rate of neonatal hypoglycemia. Regarding the diet intervention, including all the diets stated, it resulted in significantly higher weight gain during pregnancy, and then early intervention with the diets reduced the incidence of gestational diabetes as a whole and improved several maternal and neonatal outcomes. Lastly, analysis showed that modified dietary interventions showed a larger decrease in glucose and a lower need for medication treatment.
This is Bonnie, and in conclusion, the data and evidence collected shows a positive association with modified diet and less complications accompanying women with gestational diabetes. There were several diets used in the studies, and further evaluation is needed to determine the most effective outcomes. It was also noted that physical activity paired with a modified diet was evidence to reduce gestational diabetes complications.